What's up, guys? This is Dr. Nima, physical therapist from Pro+Kinetix Physical Therapy and Performance, coming at you with the second Anatomy and Pathology series. Um, Today, we're going to look at the deep kind of glute muscle, which is why you're looking at the back side of the anatomy model here, called the piriformis. And the piriformis is a muscle that is usually the cause of a lot of symptoms in the glute, maybe even radiating symptoms into the foot, some nerve sensation and some issues there, or a lot of muscle tightness causing some issues at the pelvis with running mechanics and form and stuff like that. And we'll get into that here in a second. But just to kind of kick it off, if any of you guys have experienced any pain deep in the glute, feelings of tightness or soreness in the glute, or even radiating pain with numbness and tingling down into your foot, as kind of mentioned before, this is likely due to that small muscle that's deep to the glute max, which is the larger glute muscle, and that's called the piriformis. So if we're looking at the right glute max here, and we peel back that layer, we're going to find that this muscle right here running along the inner part of the sacrum, which is essentially the extension of your lumbar spine right before the tailbone, and it attaches outwards to the hip bone, which is your femur. So I'm going to go ahead and isolate this guy so you guys can see the front attachment on the sacrum, which is these three right here, and then the lateral attachment, or what's called the insertion, right over here on the greater trochanter of the femur. You'll see how it extends out that way. So the piriformis usually helps with external rotation of the hip or turning your thigh outward, and I'm going to show that to you here. So with that knee bent, you'll see that the foot will go inward and the hip will open up outward, and that's called external rotation. And then it also is responsible for hip abduction, or bringing your leg away from your midline, and that's this motion here. And that's important because it's going to keep your pelvis stable every time you take a step, every time you are running, and the opposite leg is in stance or on the floor. And that part's important because it adds to that pelvic stability and prevents that hip from dropping a little excessively, which then causes the knee to drop inward. And it leads to kind of a host of running issues that we usually discuss with our runners and as part of our evaluation. It's also the other important part about the piriformis is that anatomically, it is very close and has a direct correlation with that sciatic nerve, which I'm sure a lot of you have heard of. So the sciatic nerve will actually run from, I'm going to peel back some of these muscular layers here, and you'll find that nerve. So it's going to run from as soon as it exits the lateral aspect of that sacrum, or that outer component, it stems from some of the lumbar nerve roots and sacral nerve roots, but as it extends out and exits, you're going to get the sciatic nerve, and that's when it becomes a sciatic nerve. So this nerve right here runs all the way down into your thigh, and then it has extensions all the way down as it splits into multiple nerves, all the way down into either the outer portion of your leg or inner portion of your leg, going down into the bottom of the foot. But the main component is up here in the glute. So, it's common when people say that they have sciatic nerve issues or sciatica. One of the possible scenarios is that it could actually be coming from that piriformis muscle. And we'll talk about that in a sec. And we're going to highlight it there. So let's talk about some of the reasons why the piriformis can be painful. So those of us that are more active can be prone to more piriformis tightness, as it's a common site for taking on increased forces or load at the pelvis, which I touched on before briefly. And those forces naturally occur with walking or running. So that tightness can eventually lead to pain or discomfort if it's not stretched properly, if it's not mobilized properly, or if the hip joint itself isn't moving in all the directions normally as it should. Now, as I mentioned before, the sciatic nerve that runs either over or it comes over the top of the piriformis, under, which is where it's sitting right now, as you can see, directly below, or it could even run through the muscle belly itself. This nerve can be influenced by tightness of that piriformis muscle, and this is because when the muscle truly gets tight, it actually becomes shortened, and that could cause an increase in pressure or compression onto the nerve, causing, common nerve symptoms including burning, numbness, tingling. And there are some fairly simple techniques to perform in order to relieve these nerve symptoms and to help mobilize the piriformis. And that's something that the physical therapist will do with you here at Pro+Kinetix. Kind of look at some of the common causes and potentially some of the impairments that may be going on, try to isolate exactly what's happening. And then one of the things, which is very common, is to help mobilize the piriformis or stretch. It's pretty common for the piriformis to become tight. However, it's not always due to tightness. Because the piriformis is an abductor, or the action where it swings away from the midline of the body, it naturally helps stabilize the pelvis. So if you have weakness in that motion, you could eventually have hip drop, poorly distributed forces through the lower leg if you're walking, running, or climbing stairs, and then eventually leading to compensation of other hip muscles, which could lead to pain in the hip, SI joint, or the lower back region. So a lot of times people will come in and they will talk about how, their glute feels really tight, they get burning, numbness, tingling down the leg, or just kind of cramping, the sensation of cramping or like it's seizing up in the glute, which then can radiate into kind of the lower back, not the common kind of lumbar area, which is this area here, but they will usually say it's kind of this lower portion of the low back, which is actually the SI joint itself. So it's important to distinguish what muscles are tight, what muscles are weak, and then in order to appropriately determine how to strengthen and stabilize the hip and pelvis, you want to take a look at that piriformis and try to see if you can prevent that piriformis pain or sciatic nerve pain. So at Pro+Kinetix, we perform, again, a full body diagnostic. We get that extensive evaluation of the problematic area, manual therapy techniques to help relieve your symptoms, and finally, an exercise routine to help maintain relief, improve mobility, and strengthen weak muscles to prevent that problem from returning. So just to kind of sum it up, let's say you're a runner, you come in for physical therapy, you're getting a lot of hip and glute pain, and it's preventing you from being able to extend your mileage or increase your pace because of that hip and glute pain. So that's something that we would look at, as we would potentially address the piriformis, and we would test the surrounding muscles in that area to see if we can isolate the issue itself. And then we would eventually give you a mobility and stretching routine, and then a strengthening and stability routine to help get everything back together and build long-term stability and give you that bulletproofing phase. Thanks for tuning in, and catch us next.